Good afternoon, ladies and gentlemen, and welcome to Dicentra's second quarter webinar for 2013. Thanks for taking the time out of your very busy day to join us today. Given the ever-changing climate affecting both the dietary products and natural health products, these webinars are meant to be a non-biased source of information. Now, before we begin, I would like to introduce Robert Silver from our Business Development Department, who would like to introduce our new service, GMP Online Training. Robert?
Thank you very much, Terry. It is certainly my pleasure to be able to introduce our new GMP Online Training program to be able to train staff members easily and conveniently on the newest good manufacturing practices for dietary supplements. This is a great new program that is available on demand, and it has an unlimited access 24 hours a day, 7 days a week, and is in fact available to an unlimited number of users, all for one flat price. And if you would like to find out more about the program, then please feel free to access our website at www.gmponlinetraining.com. Now, Terry, I'll hand it over to you for the rest of the webinar.
Thank you, Robert. Now, just a little bit about Dicentra. Dicentra provides sought-after regulatory and scientific guidance on product and marketing compliance, quality assurance, research and development, new ingredient assessments, and overall regulatory strategies for health-related products sold in North American marketplaces. Now, just a few little housekeeping rules before we begin. Due to the volume of participants, unfortunately, there will be no time for questions and answers. Also, at the end of this presentation, we will be sending you a satisfaction survey for you to fill out. We hope that you do. Also, in a couple of days, we will be sending a link to our website at www.dicentra.com of this presentation so that you can view it at any time. I would like to now introduce our first speaker, Heather Van Blerkum, General Counsel and Senior Regulatory Specialist for Dietary Supplements here at Dicentra. Welcome, Heather.
Before I begin my presentation today, I'd like to cover with you our webinar objectives. We would like to provide you with up-to-date information pertaining to the implementation and interpretation of regulations related to dietary supplements in the United States and natural health products in Canada. We also want to provide you with other scientific and regulatory information that has relevance to our industry. On this slide, you can see an overview of our webinar and the topics that we'll be covering, both in the United States and Canada. We're going to begin with the topics in the United States. During my presentation, I hope to answer a number of questions that you all may have pending. And first, I'd like to help clear up some of the issue about questions regarding quality control and GMPs. We all know that quality control is important, but when the FDA is conducting its audits, what else are they looking at beyond just the quality control issues? Some of the recent warning letters we've been seeing have had a number of revelations that may be surprising to some of you. So separate and apart from your manufacturing issues, you also need to look at your marketing and sales practices as well. For example, the FDA in a recent warning letter has stated that, in effect, liking a testimonial from a customer on either their Facebook or another avenue of social media, you as a company are effectively endorsing that testimonial and thereby adopting that unauthorized drug claim that your customer may be making. For example, if your customer says, I took this product and my Alzheimer's, I don't feel like I'm having the same memory problems, and it's really helping, and I've given it to my mother, and their Alzheimer's seems to be improved. If you go and like that testimonial on their Facebook page, you're endorsing it and thereby adopting it, and the FDA is going to find that you're in violation through that endorsement. Another area to be concerned about is when you link to articles where those articles are making disease claims. If you are selling a product to help maintain a healthy blood pressure and you're linking to articles about lowering blood pressure and those types of claims, those claims will then cause your products to be drugs. Also, we all know that the FDA is looking at our product labels, but the FDA is also looking at our website material and what we put on our websites, but also not what we put on our websites only, but also what we're putting on our Facebook pages, on our Twitter accounts. And you have to make sure that if you are allowing customers to input testimonials or questions onto your social media pages or onto your Facebook page, that you have to be monitoring those on a regular basis to make sure that they're not saying something that you can't say. The last point I wanted to alert you to is that you have to be very careful when you are building your website. If you have embedded search terms like cancer or Alzheimer's or high blood pressure, heart disease, if those are searchable terms and somebody will come to your website, the FDA is going to find that as an implied claim. Now I'd like to address some of the questions regarding Prop 65 and whether or not reform of California's Prop 65 is on the horizon. According to Governor Jerry Brown, the governor of California, Proposition 65 was intended to protect Californians from harmful chemicals. Prop 65 requires in California to give warnings if the product exposes customers to any detectable amount of hundreds of chemicals believed to cause cancer or reproductive toxicity. According to Governor Brown, he claims to be committed to reforming the law and curing the abuses that have been created by plaintiffs' attorneys exploiting the bounty hunter portion of the law. Governor Brown's administration is proposing specific reforms working with the state's Environmental Protection Agency. At the same time that Governor Brown is working with the EPA, the California Assembly has recently voted unanimously in favor of Assembly Bill 227 that would, to some extent, reform Prop 65 in an effort to stop the abuse of the law. The bill now needs to be approved by the state Senate. The version of the bill that got approved by the Assembly was somewhat watered down from the original version, but it still provides a 14-day right to cure for allegations of failure to post a Prop 65 warning. Now, here's a question that's had a lot of attention in the media lately. Where do we stand with GMO labeling? On June 3rd, the Connecticut legislature passed a bipartisan GMO bill, making it the first state to require food manufacturers to reveal whether their products include genetically engineered ingredients. So while this bill passed both chambers with a landslide, it comes with a catch. There's a trigger clause in the bill, which means that before it goes into effect, similar legislation must be adopted in at least 4 other states, including one that borders Connecticut, and those states must have an aggregate population of at least 20 million residents. The next big ballot initiatives on GMO labeling will be held in Washington State this November. There's been 25 other states that have considered bills on labeling genetically engineered foods in 2013. However, it's unclear whether other states will go so far as Connecticut. In New Mexico, the state Senate voted not to adopt the report of its committee recommending labeling, effectively killing the labeling efforts there. And efforts in Vermont, Hawaii, I need to edit this last part because there's been a new development, but so far the efforts in Vermont and Hawaii have been stalled. However, in Maine, just recently the House of Representatives voted in favor of a bill that would require foods with ingredients from biotech crops to carry the label produced with genetic engineering. But however, the bill still needs to pass the state Senate, so it's not in effect there. That bill also says that GMO labeled foods cannot be marketed as natural. So we'll see how that progresses through the state Senate. And then last week, the New York labeling bill was defeated in committee. So we still have a flurry of activity going on in the various states, but on the federal level, Senator Barbara Boxer and Congressman Peter DeFazio have introduced a bill entitled the Genetically Engineered Food Right to Know Act that would make GMO labeling a federal requirement. Typically in the past, FDA has only required labeling of foods when it deals with issues like food safety, consumer health, or nutrition were at stake. But in addition to the federal and state rules and regulations, Whole Foods Market has recently announced to label GMO-containing products. According to the co-CEO of Whole Foods Market, Walter Robb, they're committed to full GMO transparency within 5 years. They're committed to working together with their suppliers, which they're going to need to do to get every product that does not contain GMO or may contain GMO to be labeled as such. It's a big step for the consumer's right to know. However, keep in mind, this is not just a bill that applies for foods, because supplements are a subcategory of foods. This also applies to dietary supplements. And, you know, as you consider this issue and whether or not you're going to label your products non-GMO or can you label your products GMO, you need to start thinking about this now and keeping in mind the testing requirements and the ability to verify the accuracy of those claims and all the crops out there that are GMO crops, as well as the derivative of those crops that may be in your capsules or your excipient ingredients. The next question I'd like to address is, what do you mean caffeine isn't approved for use in food? We're seeing it come out now in all kinds of food. But in reality, there's no express limitations on the amount of caffeine used in foods, beverages, or supplements. However, caffeine has only been grasped, only recognized as safe by the FDA in cola type of beverages. Therefore, while caffeine is not prohibited for use in other foods, it does necessitate a GRAS affirmation. So whether or not you as a company want to go through the process and get your product and the caffeine as used and as intended for use in your product approved to the FDA, or you take the route of self-affirmation, you still need to go through that process that the amount of caffeine and its intended use in your product is safe. And so when you're looking at whether or not you want to sell your product as a food or a supplement, these are something to consider, because dietary supplements don't require the use of only GRAS ingredients. Therefore, it doesn't necessitate the GRAS affirmation process. Last month, however, because of all the companies out there attempting to add caffeine to food, the FDA announced that it's going to investigate the safety of caffeine in food products, particularly its effects on children and adolescents. Currently, caffeine is being added to foods such as jelly beans, marshmallows, sunflower seeds, and I'm sure we've all seen about Wrigley, who launched their new caffeinated gum, Alert Energy Caffeine Gum, but they decided to take it off the market after the FDA's announcement, at least temporarily, to give the FDA a chance to investigate the safety of added caffeine. And their gum, one stick of the gum was equivalent to half a cup of coffee. The Council for Responsible Nutrition and the American Herbal Products Association, two of the major trade associations, have also issued guidelines surrounding the use of caffeine in products. That would be worthy to consider when you're looking to launch a product with caffeine in it. Here's another question I want to address is, I'm not a manufacturer. Why do I have to comply with GMPs? There's a lot of companies out there that may think the GMPs don't apply to them because I don't manufacture. I contract that out. However, even if this is from the FDA warning letters, if you contract with other manufacturers to manufacture, package, or label dietary supplements that your firm releases for distribution under your firm's name, you have an obligation to know what and how manufacturing activities are performed, so you can make the decisions related to whether or not your dietary supplement products conform to the established specifications and whether to approve and release the products for distribution. Because most likely your firm is introducing and delivering or causing the introduction or delivery of your product into interstate commerce in its final form for distribution to consumers. Therefore, your firm has an overarching and ultimate responsibility to ensure all phases of the production that the product is in compliance with the dietary supplement GMP requirements. Therefore, even if you do contract out your dietary supplement manufacturing, you can't contract out the ultimate responsibility to ensure that your dietary supplement that you place into commerce or cause to be placed into commerce is not adulterated for failure to comply with the dietary supplement GMP requirements. According to some of the recent warning letters, these seem to be the most common. You have to have written procedures for the handling of product complaints regarding the dietary supplement products you distribute and for adequately investigating complaints and documenting the findings of an investigation follow-up. You have to make and keep written procedures for return dietary supplements. You must establish a specification or a point, step, or stage in the manufacturing process where control is necessary to ensure the quality of the dietary supplement and that the dietary supplement is labeled as specified in the master manufacturing record. You must establish specification for dietary supplement labels. And you must also establish specifications for the labeling of the finished packaged and labeled dietary supplements, including specifications that you ensure that you applied the specified label. So you really do have to get involved with your manufacturer and ask some of these questions. You may not even be aware of what a master manufacturing record is, but you need to address these issues with your manufacturer. And there was another issue one of the FDA warning letters pointed out was that, now that they've covered a lot of these generic basic quality control issues with companies, they're digging a little deeper and they're looking, for the other quality issues that they have. And specifically your finished product testing. If you have on the label that you have a certain amount of ingredient, they're going to test to make sure that you have that ingredient in there. And these FDA warning letters just keep on coming to own label distributors in addition to manufacturers. Here's a question some of you may ask. Why can't I label my food as a medical food, my supplement, as a medical food and make disease treatment claims? Well, a recent warning letter was issued which should serve as a reminder that you just can't relabel your dietary supplement as medical foods and make drug claims. According to the FDA, products are considered misbranded because the labeling is false or misleading if they are labeled and marketed as medical foods, but do not meet the statutory definition of a medical food. According to the Orphan Drug Act, which defines medical foods, it's a food which is formulated to be consumed or administered internally under the supervision of a physician and which is intended for the specific dietary management of a disease or condition for which distinctive nutritional requirements based on recognized scientific principles are established by medical evaluation. And the FDA pointed out that they consider the statutory definition narrowly and also the types of products that are going to fit within this category. The last thing I wanted to address was to make sure, are you still selling products that contain DMAA? The FDA issued a public warning letter on April 12th calling DMAA a dangerous stimulant and advising customers to avoid consuming any products containing the ingredient. This is a follow-up letter based after a series of warning letters that the agency sent to DMAA marketers back in April 2012. The agency has effectively rejected the research supplied by companies selling DMAA and would do everything it could to remove the ingredient from the dietary supplement market. The FDA has indicated that DMAA is synthetic and illegal for use in dietary supplements. The FDA's problem from a health perspective with DMAA is it can raise blood pressure and cause cardiovascular problems, the warning noted. From a regulatory perspective, the agency's problem with DMAA focuses on the lack of safety record and its legality as a dietary supplement. In its warning to customers, the agency referenced 60 adverse event reports it had received detailing illnesses ranging from heart, nervous system, and psychiatric problems and death in combination with DMAA use. I'd now like to introduce William Morkel, the Director of Quality and Compliance at Dicentra.
Thanks, Heather. I would like to begin with natural health products and say a few words on the NHPD Status of Applications Quarterly Snapshot. You'll notice I replaced the word report with snapshot because what was a nice 20-page report has now, at least for this quarter, become a one-page snapshot. On May 31st, the NHPD posted their report for the fourth quarter of the current fiscal year. And although very brief, like I said, it's just a one-pager, there are some important highlights to glean. First, From January 1st, 2013 to March 31st, 2013, the NHPD met their 60-day pre-cleared information performance target 88% of the time, and their 180-day full assessment target 37% of the time. I mention this because applicants always want to know how long is it going to take before they get their actual NPN. Now, these statistics, especially for the 180-day review period, don't look too good, but bear in mind that these are apply still during when UPLAR was still in effect for much of this first quarter. And much of the NHPD's resources were still focused on clearing the UPLAR backlog. In fact, during the same quarter, the NHPD received 2,176 PLAs and completed 3,208. So they were completing applications faster than they were coming in. Of the PLAs completed during this quarter, 86% were licensed, 10% refused, and 4% withdrawn. And the pre-UPLAR workload is now 100% complete. So it should be over the next quarter that we really get a sense of how well the NHPD is performing and to what degree the positive effects of the backlog clearance have been offset by the negative effects of the budget cuts. Having said that, during the fourth quarter, the NHPD received 715 amendments and notifications and completed only 317, which is rather dismal. Someone I know who works with the industry recently remarked that you are better off filing a whole new application rather than waiting for a simple amendment to go through. And I'm not advocating that approach, but the NHPD does have to address their amendment backlog. Some other highlights. During the same quarter, the NHPD received 28 SLA applications and completed 21 SLA applications. They received 326 SLA applications, SLA amendments or renewals and completed 194. And they received 11 CTA applications and amendments and completed 13. And these statistics just bear out what has been Dicentra's own experience, and that is the NHPD is completing site license applications and clinical trial applications in a fairly timely manner. Okay, now that the boring statistics are out of the way, I would like to discuss next the NHPD's consultation on the issuance of international certificates, international trade certificates. For those of us who have waited for long periods of time to get an ITC, this is potentially a very positive development. The NHPD is adopting a new approach whereby ITCs will be issued by independent third parties. This has commenced as a 90-day pilot project running from May 31st to August 28th, 2013. 3 independent third parties are participating in the pilot: the CCTFA, or the Canadian Cosmetics Toilets Fragrance Association, the CHFA, the Canadian Health Food Association, and CHP Canada, Consumers Health Products Canada. Health Canada will still issue ITCs for requests that were made prior to June 1st, 2013, and during the pilot project, you may still apply directly to Health Canada for an ITC, but are encouraged to go through the third parties. Stakeholders are also encouraged to submit their feedback to Health Canada during the pilot phase. So if this pilot project becomes fully implemented, as it likely will, it will mean a fee for service moving forward. However, I think that the trade-off in terms of faster turnaround times will be definitely worth it. And once again, this applies only to NHPs and not to drugs. The next item on our agenda are new and proposed NHP monographs, and I'm simply going to list them here without going into their actual contents. The following monographs were recently modified, i.e. since our last quarterly update: carrot, holy basil seed, holy basil leaf, sage, buccal and topical, and sage oral. And proposed revisions have been posted for the following monograph: cayenne. And that consultation is open until July 10th, so you still have time to submit your comments if you wish to do so. The following new monographs have been posted for stakeholder feedback: whey products, rhodiola rosea, Garcinia gummiguda, Grifola frondosa, calcium potassium salt of hydroxycitric acid, and Salix alba. And the consultation for these draft monographs ended May 29th, so it's too late to provide stakeholder feedback, but you can still read the drafts online. Also, chitosan, white kidney bean extract, L-carnitine, oat beta-gluten, and inulin. And the consultation for these draft monographs is still open until July 10th. Okay, we are going to move now from NHPs to a different topic, and that is establishment licensing and GMPs for active pharmaceutical ingredients. This is a significant development and will have a big impact on those of you engaged in manufacturing or importing drugs or active pharmaceutical ingredients. On May 8, 2013, Health Canada announced in Canada Gazette 2 that the Food and Drug Regulations have been amended to extend GMP requirements to active pharmaceutical ingredients. So previously, following GMPs for APIs was voluntary, now it's mandatory. A corresponding draft Good Manufacturing Practices GMP for active pharmaceutical ingredients guidance document, or guidance document number 0104, has been posted. The consultation has ended as of January 5th. However, the draft is still available online. And if you are involved in the manufacture and importation of drugs or active pharmaceutical ingredients, you should definitely take a look at that document. In addition, manufacturers, packagers, labelers, importers of APIs are now required to hold an establishment license. As of May 8th, you have 9 months to submit your establishment license application. So you can continue to operate without an EL during the transition period. And I should point out that a guidance document for establishment license for APIs has yet to be posted, and an inspection scheme for APIs still has to be worked out, so there's still some guidance pending from Health Canada, but you will have this transition period. Moreover, importers of APIs and or finished drug dosages must ensure that their API manufacturers are annexed to their establishment license. And there is a draft guidance document for this purpose entitled Guidance on Evidence to Demonstrate Drug Good Manufacturing Practices, Compliance of Foreign Buildings. That's guidance document 0080. And this is a revision of the previous guide, only it now includes active pharmaceutical ingredients. And I just want to hasten to add that none of this applies to natural health product active ingredients, so those of you dealing only with NHPs can breathe a sigh of relief. As I said, it will apply only to drug APIs. Okay, on to the next topic, which is products at the device-drug interface. On May 4th, 2013, Health Canada posted a new guidance document, Factors Influencing the Classification of Products at the Device-Drug Interface. It doesn't happen often, but sometimes you do get a product that falls in that gray area. And from a regulatory perspective, there are no hybrids. You are either a drug, which includes an NHP, or a medical device. So this document helps to make that distinction. It lists the factors taken into consideration by Health Canada when classifying a product. Now, it's not a very detailed document. There are no nice decision trees or very many examples, but it does give you a sense of how Health Canada approaches their classifications. I strongly suggest that you consult this document and not simply rely on precedents alone, because how Health Canada applies their definitions is constantly changing. Which brings us to our next topic, case in point, classification of non-medicated eye washes. A notice entitled Classification of Non-Medicated Eye Washes was posted April 2013. All non-medicated eye washes for human use will now be considered NHPs. Now, some of you may be thinking, well, NHPs must have a medical ingredient, so how can you have a non-medicated NHP? Well, this simply means that we're referring to eye washes in which water or purified water is the medicinal ingredient. Hitherto, many of these products were classified as medical devices. However, Manufacturers of non-medical eye washes holding a medical device license have been notified, and they will be given the opportunity to make representations, but will have to transition to NHPs if Health Canada determines that they fall under this category. Now, this probably won't affect too many of our listeners, but it does highlight Health Canada's mode of thinking when it comes to product classifications and how this mode can change. Okay, our next topic is one that also may not affect too many of our listeners, but it is important to mention, and that is the new draft guidance document for disinfectant drugs. So these are not products for use on humans, rather they are for use on inanimate objects in hospital and clinical settings. The proposed draft guidance was open for consultation from April 2013 until June 2013, and it will replace the current 2007 version. It is a more user-friendly and comprehensive overview of the safety and efficacy requirements considered necessary to obtain market authorization for disinfectants and disinfectant sanitizers. And it harmonizes more with the U.S. EPA and U.S. FDA standards for these products. Although in the U.S., most of these products are regulated as pesticides, whereas in Canada, they are regulated as drugs or NHPs. Go figure. Okay, our next topic is local food claims, and I have included it in today's update because it is a growing trend and is becoming more popular. The CFIA has adopted an interim policy for making local food claims. Local is now recognized as food produced in the province or territory in which it is sold, or food sold across provincial borders within 50 kilometers of the originating province or territory. Local claims are voluntary, but any labeling or advertising claims must be truthful, and how the CFIA interprets truthful will be based on this new policy. And the policy is in effect immediately, or at least as of May when it was posted. Our next topic is one that was covered in our last regulatory update, but it is important, so I just want to mention it by way of reminder, and that is food inspection modernization. Consultation on the revised draft of the improved food inspection model ended on May 22nd. The CFIA plans to phase in the implementation of this model from fall 2013 to 2016. Just a reminder of the key features of this model. Parties that import, export, or prepare food destined for interprovincial trade will be required to hold a license to do so. Parties must implement an effective preventative control plan as part of the condition for receiving and maintaining a license, and licensed facilities will be subject to inspections by the CFIA. So this is really something of which you should be aware if you are involved in the food industry, particularly in terms of importation, manufacturing, distribution. And our final topic is one that was not listed among the original webinar topics posted, as it is a new development, and that concerns revisions to the caffeinated energy drink guidance document. The Food Directorate is circulating a revised caffeinated energy drink guidance document for temporary marketing authorization, and this is to replace the March 2012 version. So for those of you selling or planning to sell CEDs, you should review this draft if you have access to it. Those who already have TMALs for their CEDs will be given a transition time in which to come into compliance with the new requirements. So some of the main areas of revision include additional eligibility criteria, i.e. whether the CED will be considered for a TMA, changes to the maximum allowed levels of certain ingredients, such as vitamins. Now, to be fair to the Food Directorate, they did say that benchmarks could change over time, but it doesn't make it any less frustrating. Many had to reformulate their products as per the original CED guidance document, and now they are faced with the prospect of having to reformulate yet again. Other changes include revisions to advertising recommendations and restrictions, clarification of criteria for multi-serving containers, and inclusion of labeling criteria for product identification, i.e. how to label a product so that it is clearly identified as a CED and can be identified so by consumers and end users. So this is an important development of which you should be aware, and like I said, if you do have access to that draft, then you should take a look at it and provide the CFIA with your, the food director with your feedback and comments. And that concludes our regulatory webinar for this quarter. We invite you to visit our website for a video of this presentation and for a list of links mentioned. You can learn more about Dicentra by visiting dicentra.com or by contacting us at 1-866-647-3279. Thank you and have a great day.